My name is Nick Crofts. I'm a professorial fellow at the University of Melbourne School of Population Health and at the Australian Institute of Police Management. I'm a public health practitioner. I was a community health practitioner for a long time, then I got into public health because I saw the same. It was a very analogous situation to what the police do. As a community health practitioner, I'd see the same people coming back with the same problems over and over again. And what was I doing to change the course of that? That's why I got into public health. And I think I've taken that experience and got very interested in the role of police and law enforcement generally in the public health mission, and see that police have exactly the same sorts of frustrations as seeing the same people coming back around and around over and over again. And what can we do to break that? 40 years ago, when I was working in community health, we tried to work out ways that we could break those cycles, and we had some interesting initiatives, but people have been struggling, I think, for a long time in different circumstances to see how they can break the intergenerational, over and over again, people going through the same sorts of problems. It's starting to come to a real focus now with this adverse childhood events or experiences work, and bringing that to bear and thinking about how do we deal with people who are coming back to us over and over again. The Dutch police, I worked with the Dutch police in Amsterdam. The Dutch police have a thing called the Top 600 program. Each year they look back at the previous year and see which 600 people gave them the most trouble, which 600 people used the most resources. And then they take them and they throw everything at them in terms of housing, employment, counselling, drugs, which is very analogous to some of the stuff that's going on in Wales, some of the stuff that's going on in Canada. A lot of people are developing these approaches now. And I think it's coming out of a frustration that the previous systems weren't working. If you take the top 600 people who have given the police department the most aggro in the previous year, and then you look at the top 600 people who've used the most health resources in terms of accident, emergency, ambulance and so on, they don't exactly map, but they overlap a lot. It's the same people a lot of the time, which means that they're not in the health system because of health reasons, they're not in the criminal justice system because of criminal justice. There's something underneath. So why are we tackling their problems through sectoral approaches? Why not get down to that? And that's where I think the adverse childhood experience work is bringing us back to a realisation that these appearing in criminal justice, appearing in accident emergency, are often expressions of that underlying process. We've got to get into that underlying process and do something about it there. Listening to the talks here at this conference, the conference in Toronto a couple of weeks ago and all that, there's an enormous amount of thinking going on at our level about what can we do, how can we break those circles. The problem I've got, and I think it was expressed very well by one of the speakers this morning, the problem that I think we all face in this area is timelines, the life cycle of these events. We're talking about long-term, generation to generation, because that's breaking that intergenerational cycle is something that everyone agrees is necessary. Politicians don't think like that. How do we get politicians who can think for the long term, which means, I don't know the situation in Wales, but in a lot of places it means getting long-term grounded bipartisan commitment to policy. And in this current world, I think that's becoming more and more of a pipe dream. We're becoming less and less in a situation where you can get consensus across political parties. I think our challenge, I think that's not a bad way of encapsulating our challenge. Our challenge is to find ways of getting politicians from both sides of the fence to see the common ground in this and the need for a common approach. The expression was used earlier on today about old wine in new bottles. And I understood exactly what they meant because I was talking with my colleagues about this 40 years ago. I worked in a suburb in Melbourne as a community health practitioner that had a lot of tower blocks, a lot of poor people, migrants, refugees, underclass, the whole thing. My wife was a teacher in the same suburb, and we both had the experience. We could identify at the age of 3 or 4 or 5 which kid was going to end up having a history of having an involvement with criminal justice, which would take over their lives. They'd spend much of their time in prison. When their prison career finished, their criminal career finished, they'd end up being alcoholic or whatever. You could pick it at the age of 3 or 4, but we couldn't do anything about it. And I think what I heard this morning and what I agree with is we're starting to get to a point where we've got practical understanding of how we can intervene. But we're still like the sessions I've just been in at the moment, we're talking about how do we bring a whole of person, whole of sector approach to people who get into trouble with the criminal justice system. But that's way too late, isn't it? I love the expression this morning, why do we want to be brilliant at fixing something we could have prevented in the first place? So I think we've still got a long way to go. And I think the other thing that's not talked about here, or hasn't been talked about here so much, is income inequality. The defining impact of income inequality in the course of people's lives. If you have adverse childhood experiences, sometimes they predict, or often they predict a lifetime of involvement with criminal justice, all the things that we've talked about, suicide, drugs, all the rest of it. Sometimes they make people stronger. Often the things that make people stronger are the social capital around them that they can rely on. That goes with income inequality. And the work that's been done around looking at income inequality as an absolute determinant of all those social evils is something that has to come into this discussion as well, because without social structural change, without income redistribution, without all of those, looking at all of the systems to overcome the impact of income inequality, the rest of it is not going to work as well as it might.